guys. How is everybody? It's so good to see all your shining faces. Let me see, take a quick peek. Yay. I love it. Some people from last week, some new people. As Jesse said, I hope you all got out and got some sunshine this weekend. I know I did. It was just finally a really good weekend. I hope everybody got some vitamin D and some fresh air. So I'm just going to open this up just to review. You know, you can put your questions in the chat. I'm going to go through some things today. I'm going to kind of touch on a few things we talked about last week because I know there's a lot of new people on the call today. And then whatever questions we can get to at the end, I'm going to leave a little bit more time for questions. And anything we don't get to today, I will definitely incorporate those questions and answer them in next week's presentation. So this is week 2 of the Wellness Warriors workshop, which I've actually been working on for, let me just share my screen with you guys. I have been working on it for a year now. I thought I would be offering this workshop in the office live, but you know, fate had different plans. So here we are offering it virtually, which is exciting because obviously we could fit a lot more people. We had about 50 people last week. We have 80 people signed up today. So it's really, really great to be able to not only get this information out to everybody because it's so precious and valuable right now, but also for us to create a sense of community. You know, I think that it's really helpful for us to know we're all in this together, and especially right now we're all feeling a little bit isolated, kind of stuck at home. So, you know, if you know me, you know, we don't have scrubs, we don't wear white coats, you know, everybody dressed professionally. Our office is like a living room, not like a doctor's office. And so for me, this is my new work attire, and I don't love it, to be honest with you. But it's the new reality, and it is what's required. So we pretty much mid-March decided that it was too risky to bring people into a common space. There was just more risk than benefit in that we might be spreading this without realizing it. And we switched over to completely virtual. So we're doing all our visits virtually. I've opened up a new COVID visit for just patients who are suffering with this virus that need assistance immediately. We're doing a lot of drive-through testing while we have the swabs. That's very limited right now. Home trip visits. So if people have 2 or 3 people, 3 or 4 people, family visits, we can do testing as well as IV drips at home. And we're going to talk a little bit about that today. And then the future is the antibody testing, which has been released in the last week or so. It's still a little confusing. You know, what to do with this information. Are people developing immunity? Are they not? Is there a question? Can we get it again? These are all questions that honestly, we don't know the answer to. In all my years in medicine, surgery, emergency medicine, critical care, I worked in an intensive care unit for 5 years. I have never been in a situation where I had to say I don't know as much as I do right now. And I'm never afraid to say I don't know. I'm happy to say I don't know and then do the research and find out. But this is the one time that the research just isn't there, that the problem has happened so quickly that the data is, you know, we're talking about studies on the news with 10 or 15 people. That's like unheard of in science. That's like not even relevant. But at this point, we need any information as it hot off the presses, as it's happening, as it's developing. And I can't even tell you how much it's changing. So even some of the things I might have said last week might be different this week as far as what we've learned in the last week. But the antibody testing, I think if you think you had it, I think a lot of people had this virus in January, February, early February. Nobody was really talking about it. If you do think you had a weird flu-like symptoms, you had something that felt different than anything you've ever had before, it's worth it to go get the antibody testing and just find out, because I do think if you have antibodies, you're at less risk for getting this. You could feel a little less fear. And that's really the way we're going to be able to start to open up society. So week 2, last week we talked about the testing. This is just an example. We did not do any in-office testing, only drive-through testing. I was in this full getup, and I just wanted to do this picture as an example so people would know what it was like. If you haven't been tested, it's a nasal swab. It is a little bit uncomfortable because you do have to really get up in there, but it's quick. It's like 2-3 seconds. And that information will tell you if you currently have the disease. Before we closed mid-March, we did a ton of vitamin drips. I've never done that many drips in my life in that month because there was a sense of urgency that I knew that if I could get these drips into people before they got sick, that it would minimize the severity of their illness. Now, for years, I prided myself on, I never get the flu. If you got the flu and you came for a drip, I would happily give you a big old hug. You know, I'm a hugger, and not even think twice about getting it. This is not the flu, right? This is probably one of the most contagious, bizarre viruses I've ever seen, and everybody is saying this. But it is something that my patients got. You know, we probably had 120 people that we managed through the virus. A lot of them had had drips prior, which was great because I think their immune system got a boost of all the nutrients we're going to talk about today. A lot of patients got it while they had the virus. And luckily, God willing, knock on wood, everybody was able to stay out of the hospital, which is pretty incredible. We did not have one patient end up in the hospital. Some of them were very ill, and it lasted a long time, but we got everybody through. And I think that the things we talked about today, the nutrients, the vitamin D, the vitamin drips, they all helped, you know, and that's important. As many of you know, Integrative Healing Center, I started in 2008, and some of you are new and you don't know me very well. So we practice functional integrative medicine, and really the whole point of our practice is to prevent disease, which I think this virus will bring really to the forefront now. I think a lot of people really don't think about preventing disease. They don't think about optimizing the function of their body, unfortunately, until something like this happens where they get sick. And I don't think preventative medicine has ever seemed more important to more people than right now. Health optimization, immune boosting, disease prevention, that's pretty much that's the whole reason for our practice. And when I meet with a new patient, I spend an hour like a detective listening to their story, their symptoms, you know, what was going on with their health as a child, what's going on with their family's health, where did they grow up? You know, I'm listening for all the risk factors that could leave that body up to getting a situation like this. You know, I'm looking for weaknesses or cracks in the foundation that would allow for illness to take hold in any given body. And so that's the things that we're thinking about with this disease. I mean, the biggest thing we're hearing is, you know, everybody in the beginning said pre-existing conditions were important. And then all of a sudden we saw these young people getting it, all these young people ending up on ventilators, a lot of them losing their lives, and they had no known pre-existing conditions. And a lot of people come to me because they want to be healthy. They don't want to get sick. They maybe had somebody in their family get cancer and they want to do everything they can to stay well. And oftentimes, I would say more often than not, we look through their extensive lab work and we find things. We find things that they didn't know that they had. They're not labeled pre-existing because they don't know about them. And I'm going to show you some examples of that today, just the lab work that we do and things that I've found in other patients that would have left me concerned for them with this particular virus and really all disease. So I truly believe that the body is designed to heal itself, and I don't fix people anymore. I used to fix people in the ER and fix people in the emergency room and sew up your wounds. But I do believe that it's my job is to just get all the facts and try to help you find the recipe to optimize your own body's ability to heal. You know, remove things from your lifestyle or things from your habits that might put you at risk, that might decrease the function of the body, because the immune system is literally your army. And right now in this particular virus, it's really the only thing we have to fight. Thieves oil. So a big thing in the beginning was the hand washing. And yes, I definitely think hand washing is crucial. It's important, but it isn't enough. You know, we're now learning about the droplet science. You know, we have to stay 6 to 10 feet away from people. There is a study out of MIT that was done years ago that showed that droplets actually traveled 23 feet, which is a little concerning in this particular situation. I found that this to be very contagious. In the very beginning few weeks, I was telling patients, you know, if the husband got it, that he should isolate in his bedroom, kind of stay away from the rest of the family as much as humanly possible. But then I watched the whole family get it anyway, really because he had been contagious for 5 days before he knew. So at that point, it's everywhere. It's on the light switches. It's on the door handles. You know, that's why I've been encouraging people to use their Thieves. You know, my concern is everybody's using bleach and ammonia and very toxic chemicals, which, you know, has their own set of problems. And, you know, I feel very passionately that we want to get rid of toxins and minimize toxins. This is a natural antibacterial, antiviral. We use this to kill things like MRSA, which is an antibiotic-resistant staph infection, Pseudomonas, very, very significant bacterial infections that are resistant to most antibiotics respond to the Thieves oil. And I mean, you could wash your floor with this and your dog could drink from the bucket and be healthier because of it. That's how safe it is. In fact, the Thieves oil, I actually have people put 1 or 2 drops in water and gargle with it. You can put it on the bottom of your feet, your children's feet. Dilute it with a little essential oil. You can spray it. I made a little room spray. And when I came out of people's houses and I took off my protective wear, I would literally spritz all the skin that was potentially exposed. I'm a big, big believer in the Thieves, and it smells great. And I love it. They have a hand soap, a hand sanitizer. My house is like covered in Thieves right now. Nothing is more important right now than gathering all the tools you can get to put in your toolbox to protect yourself and your family. And I think that exercise is very important for a number of reasons. Obviously, stress relief. We could all use a little outlet right now. Getting that cardiac function up, oxygenation, and honestly, ventilation. So this particular virus, we were treating more like pneumonia in the beginning. And then reports coming out of the ICU were like, this is not like a pneumonia. This is not your typical pneumonia. It's not wet. There's not mucus. It's dry, it's mechanical. We get something called atelectasis, which when people don't take a deep breath, the sacs of their lungs start to close down and makes it hard to oxygenate. So what they're doing in the ICUs, or really to prevent people from keeping them off the ventilators, is they're doing something called chest PT, which is literally like cupping your hands and pounding on the person's chest, front and back, right? And they're doing this as people are laying on their bellies. So we're finding that if we can pop open those lungs with that sound wave, we are less likely to end up on a ventilator. Now, you can do that with deep belly breathing, right? You can do that when you're on your Peloton huffing and puffing. You can do that when you're walking around the backyard. So keeping the oxygenation, keeping the lungs open, and that's what I've heard from patients as well, is this kind of inner intuition. They just have to keep it out of the lungs. They have to keep it out of the lungs. It's like an inner knowledge that they feel within themselves. Boosting your immune system, IV nutrition, stress relief. We're going to talk a lot about that today because I think that's big. Boosting gut health. 80% of your immune system is in your digestive system. So your gut could not be more important than right now. Optimizing your nutrients. And then, like we said, oxygenation, respiration. So eating well, supplements. Finally, I got some sun this weekend. Vitamin D, stress relief, those are kind of the keys. This is an immune deficiency panel that we do when patients come for their initial workup. And then once a year, we do this on all our patients. And you can see we look at not just white blood cells, but we look at T lymphocytes, we look at T helper cells, we look at T suppressor cells, we look at B lymphs. So the top part, this would be a section that we worry about fighting cancer. And then on the bottom, we worry about colds and flus. So, having low numbers, I would say 85% of patients that I test have some low numbers. And you can see on the side here, and forgive my messy handwriting, I definitely picked the right field to go into. Low immunity makes me immediately think of vitamin D. And this particular patient's was pretty good. It was 66, and you want to be between 80 and 100, so it wasn't terrible. And then zinc, and you really want your zinc to be above 80, 85. This was 100. So really zinc and D weren't terrible for her. So what's going on with this? What's going on with this is stress, right? So I have the 3 biggies. I've got your vitamin D, your zinc, and your stress levels. That's the 3 biggest things that are going to impact your immune system that I can help people do something about. And these are the things that we look at to say, okay, well, if you're here, so now this patient would have been susceptible to get the virus and probably a pretty severe case, right? Had we not done something about getting those adrenals stronger, getting their immune system, and really just acknowledging the effect that stress was having on the immune system. These are other levels that are very helpful for me. ESR and CRP are 2 inflammatory numbers, right? So there are numbers that if they're high, your body already has an inflammatory fire going on, right? So your immune system is, like I said, your army. If you're fighting 3 different battles, how well do you think you're going to do, right? I want to remove all the possible things your body could be fighting and have you fight just what's in front of you, which is this virus. So looking at things like SED rate and CRP, many patients have hugely high numbers, and I'm going to show you some of those, and they have no idea that it's happening. They don't. Oops, we got to mute somebody there. Jesse, you got that? Epstein-Barr is another virus that a lot of patients are testing positive for, meaning you had mono as a kid and now it's come back to kind of haunt you. It makes you feel tired, makes you feel achy. A lot of people walking around feeling tired and achy. But it is something that if your Epstein-Barr is active, again, your immune system is already fighting a virus. Now it's got one more virus to fight. Vitamin D levels, we're going to talk a lot about. DHEA and testosterone, these are your sex hormones. So, you know, we think about testosterone, we think about sex drive, but really it's our drive to do anything. It's our drive to, you know, get on the Peloton and exercise. It's our drive to get out there and do our hobbies. It's our fight. So if you feel like you're already run down, you're already burned out, and then you have to deal with something like this, you're at a disadvantage. And I'll talk about that in a little bit when we talk about stress. Zinc levels are important, ANA, celiac genes. So these are the things that are autoimmune, which a lot of people are walking around with autoimmune conditions that they don't know they have. And that means your immune system's already sort of confused by things. And so adding a virus on top of that isn't great. So, you know, how often do people check the status of their physiology, right? My light comes on in my car, I'm going to the garage, right? I'm not going to ignore the oil light. I'm not going to ignore the check engine light. But our body is giving us symptoms. Symptoms are what is our engine light, right? Tired, achy, rashes, hair loss. These are the things that it can indicate we need a little maintenance. And that's what we're going to talk about today. A lot of people are walking around. We know that hypertension and diabetes are two of the risk factors, pre-existing conditions that we worry about. And a lot of people are walking around with pre-diabetes and they have no idea. You could be pre-diabetic for years before you become a full-blown diabetic. And it is the most preventable and reversible disease on the planet as far as I'm concerned. And hypertension is known as the silent killer because a lot of people have high blood pressure and they don't know. So getting a home cuff if you have a family history, if you're getting headaches or anything like that, it's very, very important. CRP. So this is an example of a relatively healthy person who came in to get their new patient blood work done. And the CRP should be less than 1. And it was 13. So that is a 13 alarm fire. And the SED rate should be less than 15, is in 36. So we've got a pretty significant, you know, inflammatory condition going on in this body already. And those are things you can calm down with very simple things. You know, food intolerances are a big trigger for inflammation. Food intolerances are a major problem, I believe, in the United States. Everybody sort of has some version of leaky gut because the food is crap, to be honest with you. I mean, you know, it's like we're spraying everything. We're taking wheat, we're genetically modifying it. We're spraying it with, you know, glyphosate, where the dairy is, the cows are eating the grass, which is contaminated with pesticides. It's going into the milk. So the milk and the dairy and the gluten, as you guys know, I immediately bad. Those are easy. Those are easy peasy. Those are like cheating. When I say go off dairy and gluten, it's like not a big deal. Anybody is being honest with themselves feels better if they go off dairy and gluten. But when we do food sensitivity tests, it's more specific to you. So let's say you used to love to put whipped cream on your blueberries and your body was seeing dairy with some pesticides and blueberries. Dairy, pesticides, blueberries. Well, blueberries might develop a food sensitivity for you. Or let's say you used to put, you know, cheese on your arugula salad with some croutons, and your body was seeing gluten and dairy and arugula, gluten and dairy and arugula. These are things, without the food sensitivity testings, I honestly can't heal leaky gut. I can't help you create an individual recipe for yourself. When we do a food sensitivity test and we pull you off these foods, it's so easy to heal a gut. But it is something that is priceless to help you get an individual plan for yourself. And it only takes 6 weeks to heal your gut. It doesn't take all that long. But when you have a leaky gut, you've got decreased immunity. You have increased likelihood for autoimmune disease. You have decreased nutrients like B12 and folate and iron. They're going to affect energy and memory and endurance. And you upset the neurochemicals like dopamine and serotonin. So you're going to experience anxiety, depression. You know, who's not walking around with some of these symptoms? Healing the gut is relatively easy. We take you off your food sensitivities. We give you a really good probiotic. We encourage lots of good fats, avocados, good fish oils, good cold pressed olive oils. Avoid the gluten and the dairy. You know, do a green smoothie every day. Let that blender pre-digest those leafy greens and that good, you know, antioxidant fruits, and really make it easy for your body to absorb. And it also increases fiber. You know, getting a handle on those food sensitivities for me is the key to getting people well. And we do this for 6 weeks and we heal your gut. and you are much better off for it. And I always want to remind people to listen to their bodies. Listen to your body. If you're tired, if you feel less vital than you did a year ago, if you're achy, if you feel forgetful, you can do something about that. Those are all just little signs. Your body's putting up the white flag that it needs a little help. And this is just a picture of the leaky gut. What happens is literally nutrients are supposed to cross through these little barriers here. And when there's a leaky gut, now food can cross in. And then the food is in the bloodstream, which doesn't belong there. And your body starts to get confused. And this, for me, this is the cause of all autoimmune disease, is the leaky gut. Why does the body attack the thyroid? Hashimoto's, right? Graves' disease. Your body literally thinks your thyroid is the bad guy and you develop an autoimmune condition. Rheumatoid arthritis. Why does some people's body start attacking their joints? It's not normal. There's no other country that has the level of autoimmune disease as the United States. And it has to do with the food supply. It has to do with the toxins. And it is very important. The most important thing is to get your gut healed as quickly as you can. So vitamin D, a lot of information on vitamin D coming out, a lot of studies now, early studies, data is coming out that definitely shows, I talked a little bit about this last week, that the patients who have even moderately decent vitamin D levels, not even therapeutic or ideal, are getting much less severe cases of COVID-19. And the patients that ended up in the ICUs and on the ventilators in these small studies definitely had low vitamin D, like significantly low levels. I don't really think you can get vitamin D from food. I mean, if you look at this picture, we've got milk and cheese and cereal, and those are all the things I was just telling you not to eat. The fish is an issue. The big fish is full of mercury. So salmon, tuna, swordfish, they're really toxic. I usually just tell people stick with sardines and anchovies and bronzy, little fish, literally small fish. So you're not going to get a lot of vitamin D from the food supply if you're eating, as I would consider, healthy. Sunshine is really where we got vitamin D. But I was saying last week that I've been seeing lower and lower levels of vitamin D in my patients across the board over the last 3 years. Every year it gets a little bit worse. I have to give more and more vitamin D. A lot of you saw me years ago. I probably told you to take 1,000 international units, or 2,000 maybe, go to Florida, get some sun in the summer. And I don't think that's the case anymore. I've been taking 10,000 a day for this year, regardless of sun exposure. Now, my theory on that has always been pollution. Right. So I believe on the East Coast of the United States, probably several other areas, that pollution has created a cloud, and everybody's driven into the city on a smoggy day where you see almost like a dome over the city. And the UVB rays are what you need to come through the sky, hit your skin, and make vitamin D. So with the pollution, the vitamin D has been limited. The UVB rays can't really get through as well as they used to. It's almost like a filter that's been created. Now, we've all been hibernating for the last 6 weeks, and the pollution is lifted. So what will be very interesting, and I can't wait to check vitamin D levels in patients in the next couple of months, is that problem solved? Is the sun going to work? Now, I was outside yesterday and burned much quicker than I normally would have. I didn't put sunscreen on for 20 minutes. I got a sunburn. I was like, whoa, wait a minute. I definitely think we're going to see that vitamin D issue get better. I think now that the pollution has cleared, we're going to be able to get those UVBs rays through, and we're going to be able to get more vitamin D from the sun. That's my theory. I can't wait to prove it, but it's something that is very interesting to me. But mostly, the last 3 years, what I've told patients, you need to supplement. It's the one supplement I don't think you can get from anywhere else. And it's one of those supplements you really need to get your levels checked. Every cell of the body has a vitamin D receptor. We don't even know the half of what vitamin D does in our physiology. I believe that. 70% of the US population is reported to be deficient, 40% globally. So that speaks to that whole pollution thing. Why in the United States more than other countries? Even places that are close to the equator are showing deficiencies. It impacts your bones. It impacts your immune system. There's studies absolutely showing it's directly related to reducing risks for upper respiratory infections. And we know with fact that it definitely impacts flu virus. So, it's not such a big jump to think it's going to have an impact on this particular virus. Sun exposure, food sources, supplementation, you have to get your levels checked because it's fat soluble, so you can take too much. My goal for my patients is getting that vitamin D up between 80 and 100. That's where I know you're protected from the flu. I think, and again, I have no proof, it's just my observation. I think it has been a big determining factor in my patients doing much better than most with this particular virus, because it's the one thing that everybody's doing is taking their vitamin D. I wasn't able to get drips in everybody. Not everybody's perfect with their diet. Not everybody was taking zinc, but D was one thing that everybody was doing, and I definitely think it makes a big difference. This was that study that showed that very few people actually have good levels of vitamin D, and then the ones that ended up with the mild cases all had good levels of vitamin D, and the severe cases had very low vitamin D. So these are small studies, but they're just starting to come out. This problem is escalated so quickly. We are slow to bring the research to catch up with it. So vitamin drips, why vitamin drips? In the hospital, in North Shore's hospitals, Northwell, they're using IV vitamin C in the ICU to treat COVID, which is just so exciting to me. I mean, we have to credit one physician who did some studies with septic shock a few years back, and he showed a marked improvement in decreased death rates with people in septic shock when he used IV vitamin C, which is why I think they went to that for this particular virus. They're using much lower doses than I would use. They're using 1,500 grams of vitamin C in the IV every 6 hours. So it's like a continuous, I like that they're doing it periodically throughout the day, every 6 hours, but it is a much lower dose. I would give you 10,000 to 25,000 grams of vitamin C. B complex, B12, magnesium, zinc, selenium, glutathione, and then hydration. So a lot of my patients were very sick before they got this virus. And those were the ones that I went into the house and I gave them an IV because I knew that they needed it to stay out of the hospital. And I had patients on immunotherapy, chemotherapy, dialysis, lung cancer this year, stomach cancer this year, some very significant risk factors, and they all, knock on wood, all did well. So, these are the nutrients you're starting to see these studies come out in selenium and zinc, and that's just bypassing the gut and giving you a big old dose. And they're all water soluble, so you can't kind of overdose. Body's going to take what it needs, and it's going to let go of the rest, and it's going to go right where you need it, which is your immune system, and then your adrenal glands, which is really tied into stress. So these are things you can do at home. We shared our protocol last week. We sent out last week's lecture by email, and we also put a link to the protocol, and we put the PowerPoint slides are on our blog. So at the end of the PowerPoint, I have our website, drchristineblanche.com. And if you go to our blog, all this information is there. You can download the PowerPoint, you can go to the links, you can order these things, for your friends and family. Zinc, it's very interesting. Zinc is crucial in 300 different metabolic processes that we know of. And it plays a major role in the immune system. It's in most over-the-counter formulas for colds and flus. We know that it's significant for wound healing. And if you don't think these patients are having wounds in their lungs, they are. So if you have low zinc and you can't heal your own lung tissue, you're in trouble. It's anti-inflammatory, it's antioxidant, right? Interesting, right? This crazy symptom that people are getting where they can't smell or taste. And zinc is directly related to our ability to smell or taste. So when patients come in, very rarely do I ever hear that symptom. We think about brain conditions, we think about brain tumors, but always we think about zinc deficiency. So it's interesting, and you wonder, if those patients are particularly deficient in zinc for some reason. It affects the T cells and the B cells, that are in the thymus, which is in the chest that fights the immune system, and the bone marrow. Those are all those immune deficiency cells we were just looking at, and it helps fight the pathogens. And symptoms would be hair loss, low sex function, low libido, poor wound healing, mood disorders, meaning like depression, anxiety, and then diarrhea. So these are symptoms that you could think about. Now, I have never given zinc in 15 years of checking people's labs until the last, I would say, 6 to 9 months. I never had to. If you had a cold or a flu, I would say, go get some Zicam and take some zinc, use a zinc lounger. But I've never put a patient on zinc until this year. And this year, almost, I would say 8 out of 10 patients were having zinc deficiencies. And I kept going like, I don't know why. It's like what happened with D, right? All of a sudden, I have to give zinc. So zinc, where does it come from? Let's look at some of the foods rich in zinc. Oysters, meat, crab, shellfish, pork, beans. I usually think about nuts and seeds. Nuts and seeds I take everything else away from people, right? My patients eat a lot of nuts and seeds, right? And so I kept going, well, there must be something going on with the farming practices or maybe the processing plants with the nuts and the seeds. I don't know what it is, but I have not seen vitamin zinc deficiency in 15 years until the last 6 to 9 months. So if you came into this flu season with low D and low zinc, that's two key ingredients that boost the immune system that help fight flus particularly. So it's very, very interesting stuff. So this was interesting. I just found this yesterday. You guys know I do thermography in the office, and I'll go over that just in case anybody doesn't know what that is. But thermography is basically a camera that picks up inflammation in the body. So it will show me if you have Hashimoto's, it'll show me a big hot spot here. If you had leaky gut, I could see the loops of bowel that would light up in the colon and the small intestines. I can see weak immune system will show a cold spot over the thymus. Really, a picture's worth 1,000 words when it comes to thermography. But this is a picture of somebody with COVID-19 and what it looks like on thermography, which I had never seen. This is a normal chest x-ray here on the right, in the bottom right. This is somebody with acute respiratory distress syndrome, which is what we're seeing with COVID-19. And you could see it's sort of like, we call it a ground glass appearance. You could see this dark is nice, clear lung. And this is like everything just sort of like thick and hard to get through, right? And that is what this is up here in the thermography picture. This is what the lungs look like. They're inflamed, right? They're showing inflammation. And so everything that we think about is anti-inflammatory, right? How do we keep this out of the lungs? Mechanical ventilation is not the answer. You know, when my patients are sick and they're curled up in a little ball and I say, get up and go up and down the stairs, get out and walk around the backyard, keep your lungs open, right? Forcefully exhale, forcefully breathe, literally pop those lungs open. So the thermography is such a great tool for me. I mean, I almost have every patient do the thermography. It gives me so much information about what's going on in that body. And it makes sure I'm not missing anything. It's really a test of physiology more than anatomy. You know, it tells me how the body is functioning. Your MRIs, your CAT scans, their anatomy. Where's the mass? How big is the mass? Thermography is, you know, where is the inflammation? You know, carotid inflammation, we can see it on thermography at 5 or 10%. The normal ultrasound test, which is called a carotid duplex, is going to be normal until you hit 50%. So if you have a 49% blockage in your carotid arteries, they're going to tell you it's normal. There's nothing normal about 49% inflammation and blockage in a carotid artery, right? We're going to see it at 5 or 10%, right? And we're going to make lifestyle changes, and we're going to start a fish oil, and we're going to get that to go away before it's a problem when you're 70, right? So a lot of information comes from thermography. It is a huge part of our practice. We could see so much, and I love it because it's also like such a great before and after for patients. You know, they get to see their before. We put some action plans in place. They get to come in and see their picture, and they're like, holy crap, like I did that. You know, I got to make that change in my body, and it gets them excited. It takes away a lot of fear. So a lot of women come for thermography because they're, you know, concerned about breast cancer, rightfully so. And we take a picture and we could see, is the breast more dense on the right than the left? Do they have mild, moderate, severe density? Are there any patterns that are suspicious? How suspicious? Is there a problem with lymphatic drainage? We gather all this from that picture. We have them start a breast protocol. We have them do some dry brushing. We bring them back in three months, and they get to take a picture and see that they made a difference. That is not, it takes fear and it turns it into feeling empowered, which is just, it makes my soul sing. We were talking about the lung inflammation, and this are 2 oils I wanted to bring up because they're my go-to when it comes to cough, allergies, any congestion in the mucous membranes, whether it's sinus or lung. This has been my go-to. RC and Raven are my 2 oils I have all the patients using, rubbing it on their chest, you know, putting it in a pot and breathing it in. You know, remember you used to put steam and you put your towel over your head and you just take those breaths in. You could put it in the bottom of the shower and close the drain and let it just kind of steam. It's a blend of 3 different eucalyptus oils, and it works like a charm. I mean, I remember one time I think I had a sinus infection like 10 years ago, and I actually took a tissue and sort of put a few drops on the end, put it up there, opened it up like immediately, because with sinuses, you got to keep them draining so they don't get clogged up there and get infected. So RC is just so good. Raven is another one. Again, it's a blend of eucalyptus. There's some lemon in there, wintergreen. So it's a little bit more of a open up sort of feeling when you use Raven. You could put it in your diffuser. You can diffuse it throughout the house. These are my two go-to respiratory oils when it comes to anything to do with mucous membrane inflammation. So again, stress. How is stress a factor? I mean, who the heck isn't stressed right now? There's financial stress, there's social stress, there's fear stress, there's a lot going on. I mean, you know, I've been doing a lot of virtual visits, and we're talking a lot about anxiety and depression and fear. And I'm being really honest with my patients. I'm riding that roller coaster right along with you. Like, we're all human beings. Nobody's ever lived through anything like this before. And so, you know, I think I had my first panic attack ever in my whole life throughout this thing. And it's nothing to be shy about. It's nothing to hide from people. It's a lot. A lot of people are getting nightmares. And so the stress relief has been my gift, my goal, you know, my savior, if you will. I've been doing my yoga, my meditation, my oils, lavender, peace and calming, all the things that are going to help the body just chill and just be is essential right now. Your immune system is directly impacted by stress. I'm sure you've all experienced, you know, coming home from college and finals and getting sick, you know, Christmas vacation, you know, coming home in May after college and you did all those finals, you were so stressed out for 2 weeks and then getting sick, right? Your body gets impacted by that stress. You survive, you get through, and then you get sick, you know, you crash and burn. So we know with absolute certainty that the stress is going to negatively affect your immune system. So what can we do about that? We can do a lot. You know, we can do meditation. We can do deep belly breathing. We can do visualization. I love putting on a progressive muscle relaxation, beautiful voice, tighten, you know, your feet, relax your feet, tighten your calves, relax your calves, literally tightening and relaxing the whole body. Just it's reminding the body that you're tense. It's reminding your body that you need to relax. Deep belly breathing stimulates the vagus nerves, runs through the chest, lowers your heart rate, lowers your blood pressure, sends blood flow to that digestive system, which we've been talking so much about. Yoga saved my life. I used to be the most uptight, type A, crazy person. Yoga is my go-to. It is what keeps me sane. It is what keeps me going. And I can't speak enough about it. These things have never been more important than they are right now. You know, deep breathing, the Wim Hof breath method, you guys should look it up, Google it on YouTube. It's a wonderful way, like we talked about, popping open the lungs, right? Right? Holding it. It's very, very important to oxygenate and to keep those lungs open. It's just really gotten more common, more popular in the last year. And I definitely think that patients are benefiting dramatically when they have this virus and they're doing these breathing techniques. Anti-inflammatory diet, right? So you are what you eat. And right now it's very important. I drove on the way to a home visit 2 weeks ago, past Wendy's, a line literally around the block. I was just beside myself because that's just such the wrong thing for people to be eating right now, you know? We have to feed our immune system. We don't have the luxury to be able to eating a bunch of crap right now. Avoiding dairy, avoiding gluten, lots of leafy greens, gluten is a huge toxin. It's a huge inflammatory trigger. Avoiding toxins, right? So just like I said, I'm a little worried about everybody using all this bleach and this ammonia because that's toxic on the system, which make it hard. So are things like salmon and tuna and swordfish. I mean, we just don't have room for it right now. We don't want to bring in toxins for our body to have to be distracted dealing with that mercury. I want it to be focused on keeping my immune system strong. Sugar shuts down the immune system for 6 hours, right? We know cancer loves sugar, right? So most of us, the comfort food is sugar, right? So we go for our sweets. It's what we were taught as a little kid. When we were good, we got a lollipop, right? It's like this terrible belief system conditioning that we had. So we want to try to avoid high fructose corn syrup, eat low glycemic diet, alcohol, right? I mean, who the heck, I'm guilty, right? Who the heck isn't drinking more than they used to, right? Everybody's posting online. It's like 5 o'clock somewhere every day, right? But your body is going to get distracted by that. It's going to tax your immune system. It's going to not be what you need right now. Whey protein, a lot of people doing the protein shakes. Whey is dairy. Whey, in my opinion, is not the shakes you should be doing. You should be sticking with a pea protein or a vegan protein or maybe a bone broth protein. So organic veggies to avoid the toxins. organic, low glycemic fruits, right? So I'm not eating a ton of like mangoes and oranges and grapefruits. I'm sticking with my green apples and my berries and my blueberries and my raspberries and my strawberries. Grass-fed, grass-finished beef, right? Pasture-raised poultry. Tyson and Purdue both shut down their factories, right? Because those people are working in such close quarters that I think it was like 800 people in the Purdue factory tested positive. It's really disturbing when you start to think about our food supplies and food contamination. Shop local. Our local businesses need it, and also it's good for us. Green smoothies, and just really think about we are what we eat. Medicinal mushrooms. So again, anything that's going to boost your immune system is going to be beneficial right now. So as part of my treatment protocol, you guys saw part of my prevention plan, and part of my treatment plan was included medicinal mushrooms. They are very, very rich anti-cancer, anti-tumor properties, antibacterial, antiviral, blood glucose regulation, improved heart health. It kind of hits all the different areas. You know, acupuncturists have been using mushrooms forever for everything, right? And there is really something to that. They even help with stress and anxiety. So immunokinko is one of the ones I've been using for years. The main ingredient is something called AHCC. Primarily, I've been drawn to this because it's anti-cancer properties. And my big passion is preventative preventing cancer, holistically treating cancer. And so that's something that I spend a lot of time researching, but it's really working on all the T cells. And just like it works on cancer, it's going to work on viruses as well. So this is my big go-to when it comes to Epstein-Barr. Anybody who has a virus, we want to boost the immune system, and this is one of my go-to formulas for that. Preventative is 2 per day, and then for treatment, it's 4 per day, 2 in the morning, 2 at night. This is another mushroom formula, my community extract, really kind of hard to find right now. It has been on back order, then it comes back for a few days, and it goes on back order again. But you could see it's just a blend of a lot of different mushrooms. It has a lot of different immune boosting, adrenal boosting, mushrooms in there, and it's really, really protective for the immune system. So I've been taking this every day as a preventative. Heat, I want to bring this up again. I know we talked about it last week, but this particular virus does not like heat. So even when people are having fevers, I'm like, try to hang in there. Don't treat the fever. You know, if you need to take Tylenol for some pain relief to get some sleep, fine, but no Motrin. Motrin has been shown to make it worse. And if you can stand it, get on your biomat, turn up the heat, get in a sauna, turn up the heat, grab, you know, an Epsom salt bath, a hot shower, like whatever you can do to increase the body's temperature is going to help you kill off the virus. And that's what it's all about, is using the immune system to kill off the virus and using our knowledge about this virus. You know, I wouldn't necessarily say that. I never want to believe in suppressing fevers. I think the fever is the way that the body can fight disease. I think people get fevers on purpose because it kills bacteria and viruses. That's one of the reasons that elderly patients are struggling, because they can't mount a fever. You know, they don't have the immune system strength that we do at 30 and 40 years old. I've had patients in their 80s get a urinary tract infection and present with full-blown mental status changes. No fever, no burning, no symptoms. They just go immediately into septic shock and end up in a hospital. So that's the same thing that's going on, is these patients can't mount a fever. A fever is good for us. And the fever is going to kill off the virus. So this is just a quick review of the immune boosting plan. I've been adding things to this, you know, because a lot of things are very hard to get. I'm usually a brand snob. I'm very, very particular about brands that we take, because I don't know, they're not all created equally. You know, the supplement industry is not regulated, so it's kind of a free-for-all. I have my specific brands, but like zinc, for instance, I'm like, if you can get it, get it. You know, I'd rather you take something than nothing. But I've been adding to this as we learn more, as data comes out, as other doctors tell me what they've been using to get their patients through it. I've been adding to this protocol and will continue to do so. And we constantly update it in the full scripts as well as on our blog, so you can keep an eye on that. But this is just a preventative, all the things I could think of that would help your immune system prevent this disease. And then if sick, we basically up the dose of vitamin D to 20,000 for 3 days. We add a lot of the flu remedies that we would normally use. And we really just up the immune boosters to a higher therapeutic dose for treatment. And then obviously we can do acute care setting would be the superimmune drips, hydration boluses, because there are a lot of dehydration with this, with the fevers. And then raindrop technique. I mentioned this because we can't do raindrop in the office right now, but a lot of my Patients over the years have gotten excited about the essential oils. They have a lot of them in their house, and Raindrop is a kit that you can buy online, and you can dribble it on your spine. You can Google a YouTube video on how to do Raindrop and do it on your kids. Basically, it's putting oils on your spine and the bottom of your feet, and this is very, very good for the immune system. It has things like oregano, and you smell like a pizza when you do a Raindrop on yourself, but boy, do you feel good. So this is our new website, drchristineblanche.com. And if you go to the website and you look at the blog, all of my articles, all of my information, all the webinars will be on there. All the PowerPoints will be attached to that. We're trying to communicate. Our phones are up and running, but we have a Clara text service. So if you guys want to text us questions, if you need an appointment, if you need someone who needs help right away, like I said, we are offering a 30-minute COVID appointment to anybody that I could just support them through this virus. So they don't have to become a patient. There's a lot of things that we can do to keep people out of the hospital. So keep that in mind. If you do know somebody who's in trouble, or if you guys need me, I'm here. The vitamin drips, we're limited, but we try to do 1 day a week where we'll go out and do the field visits. And as the antibody tests are now available, we could be able to do that. We haven't quite figured out the safest way to be able to do that. I know that CityMD, a lot of the places are starting to offer antibody testing. So if you do think that you've had it, and it is a good idea to get the test done. And we're going to open it up for some questions.
Sorry, it took me just a moment to find my little unmute button now that I have this chat up. We got a lot of very good questions. So what I want to do, because we do have a couple of minutes, I want to stick to what we went over today as far as questions go, and then we'll branch out into the questions that weren't quite on topic, but are very important. A lot of people are asking about vitamin D with K2. So that question did come up, whether or not we should be taking vitamin D with K2 or regular vitamin D okay.
It's a great question. So there's a lot of data to suggest that vitamin D absorbs more effectively with vitamin K. And I agree with that. Most of my patients are getting their vitamin K through their diet. So almost everybody's doing a green smoothie. They're eating tons of leafy greens. And I prefer to get vitamin K from the diet. The reason is I do MTHFR testing, and that's a gene that a lot of patients have. And if they happen to have a mutation on that gene, which is more common than not, then vitamin K could actually be potentially detrimental for them. In that the MTHFR mutation makes them more hypercoagulable, more likely to have clots, and vitamin K will do the same thing. So rather than give it as a supplement and risk any harm, I do vitamin D, and I encourage a lot of nutrient-dense vitamin K foods, so we get the vitamin K from food itself. That's a great question.
Okay, also, the Immunokanoko versus the My Community. I know that we do suggest both. Do you suggest taking them both at the same time, or do you prefer one over the other?
I'm doing both of them. Like I said, anything that I'm not usually one to throw the kitchen sink at. I usually go slow. I do one thing at a time, because I like to know what's working. But in this particular virus, I'm throwing the kitchen sink at it, because if anything that I can do to keep you from getting it and have you get better quicker is what I am doing. So I am using both as a preventative just once a day. As I said, the Immunokanoko 2 in the morning, and I do my Community. But then for patients who get sick, I up the dose. So you do 2 in the morning, 2 at night, and then the My Community you could do a couple times a day.
Excellent. On to a little bit of food questions. We had 2 questions that are actually, I'd really like to know the answer to as well. Do you prefer farmed fish over wild fish? Which do you prefer and why?
Great question. So definitely wild. Wild fish, I mean, listen, there's mercury in all the water. So it's like a given. Even the sardines and the anchovies have a little bit of mercury, but your body can handle that small quantity. The farmed, we're dealing with a lot of pesticide runoff. We're dealing with PCBs. PCBs are very difficult to detoxify. It takes the body 20 years to get rid of PCBs. So I don't eat any farmed fish for that reason.
Excellent. And I know that right now we're kind of limited in where we can go grocery shopping and where we can purchase all this produce we're looking for. Do you have a preference of buying either organic at the grocery store or from local farms that could be lightly sprayed?
So it's a good question. I mean, the term organic is getting a little flimsy, right? What's organic? You know, farms to label the food organic, they have to not spray any pesticides. They have to prove their soil was not sprayed for years before they planted. And there's some regulations in place for their particular farm. There's always some crossover. So if the farm 5 miles down the road is spraying, there's going to be in the air, it's going to be in the water. I mean, I have a farm in my backyard that's not in season yet. I wish it was. But I have to acknowledge the fact that when I'm at work, my neighbor might spray pesticides, right? So, you know, it's all a little bit relative. I think, you know, the farms, you know, when you buy organic, when you buy local, if you can, but you got to do the best you can. I mean, I have to acknowledge that my spinach growing in the backyard could have contaminants from the neighborhood. Unless you're growing in a greenhouse with, you know, water filtration systems, you know, it's one of those things. So the more you can reduce your intake and be as careful as you can is the way to go.
Thank you. As far as the RC and the Raven, you had talked about those today being very beneficial in anyone who may have a stuffy nose or any kind of respiratory infections. Is there a prophylactic use of RC or Raven with COVID?
It's a good question. I don't know the answer to that. You know, I think prophylactic in that it's just keeping the lungs open, keeping the mucous membranes less inflamed is probably beneficial. I use it a lot too for allergies. So like I'm allergic to pets. So if I'm around somebody's dog, I'll use it just to kind of keep my allergies at bay. So I do think that that's helpful, but I don't think it's going to protect you from getting COVID.
Dosage recommended.
I couldn't hear you, hon.
Sorry, vitamin C. We had a question about whether the liposomal version of vitamin C is better and what would be the recommended oral dosage.
So vitamin C, I mean, liposomal is a little better absorbed. Vitamin C is tricky because you can only absorb so much. Your gastrointestinal tract can only absorb so much at a time. So 500 spread out throughout the day. So I'll do some at breakfast. I'll do some mid-morning, take some with lunch. If you hit your maximum of vitamin C, you're going to get diarrhea. You're going to get loose stools. So, and everybody's tolerance is a little different. So Jesse might only be able to take 3,000 where I could take 6,000 before we get loose stools. So you could kind of figure out what your personal maximum is by taking 500 like every hour. And when you hit diarrhea, you know what your maximum is, right? So if I can go to 6,000, then I might take 5,000 and spread it out throughout the day. So that's just kind of a good rule of thumb. It's a little bit different for everybody.
Sorry, can you hear me now?
I can hear you now.
Excellent. Yep. Going back to COVID, and we did have a quick question on that. We want to talk more about the deep breathing, those Wim Hof methods you had discussed. What's the importance of this and our overall health even without it?
All right, Russ, I have an in-house expert. You want to share your experience with the crowd?
Sure. Yeah. When I discovered that Wim Hof method, just look him up, WIMHOFF. There's a lot of great pieces. Vice did a great piece on him. He's sort of this famous Iceman who developed this breathing technique that, combined with cold exposure, that he can control, basically influence his autoimmune response to all kinds of things. And he's been tested by labs and scientists all over the world. While he's doing it, he's trained regular people to do it, and they've gotten the exact same results as him. Just incredible, like, Guinness Book of World Records type thing, but it's something everybody can do. And I've been doing it for a couple of years. And when I got COVID 30 days ago, I had a history as a young man of asthma. So I knew it was very important to keep that out of my lungs. And that technique, I think, combined with all these other things that Christine had me doing, the supplementation and the heat and hot showers and all that, but I think that deep breathing was huge. And what it does, it's basically a hyperventilating technique kind of, and it over-oxygenates your blood, changes the pH level number of your system. It takes a little getting used to, but it's basically this particular technique is 30 deep breaths, and they're full inhalations with an easy exhalation. So like that 3 times in a row. Okay, you get a little lightheaded. On the 30th breath, you exhale and hold it out so that you have no air in your lungs. You hold it as long as you can until you feel that adrenaline tickle in the back where you know you need to take a breath. Once you feel that, you take a deep breath, hold it, and kind of squeeze it up into your head, fill your head with blood, and squeeze that and hold that breath for like 10 or 15 seconds, and then fully exhale. And then you do that 3 times. 30 of those quick breaths, exhale, hold out, and then inhale, hold in. And you do 3 sets of that a day. And during this COVID thing, I was doing that like 3 times a day, so that routine. And I think it really accelerated my healing. It kept that cough from getting here to here in my chest. And definitely look him up. Google Wim Hof. There's a whole bunch of stuff on him. Really, really amazing. And the thing that gets me is it's not woo-woo stuff. He's tested and been tested over and over and over again by labs, and his results are incredible. So take a look at that. But any deep breathing, I think, was the huge key for this. Absolutely.
Thank you.
Thanks, Ross. I've just entered a nice website that you can go to for Wim Hof if you had any interest in that moving forward. A couple more questions for you, Dr. Blanche, and this is going to touch on something we haven't yet discussed today, but we're getting a lot of questions on it. People want to know whether we're going to be offering antibody testing and what we feel the accuracy of those tests may be.
It's a great question. I mean, part of me is holding off a little bit to try to get my hands around the accuracy. There's a lot of different antibody tests out there right now. Many of them are not, they've been kind of blessed by the FDA. They can do it, but they're not approved. They're having to self-validate, and they don't have time to do third-party testing where another company will validate. So I've been sort of holding off. We're starting to do some of the antibody tests that we have available so I could see if it's accurate. I am getting the data. So we'll be offering it when I know that the testing is valid, it's accurate, and I feel comfortable with that, which I would say in probably the next week or 2. I don't want to rush to just offer a test that is not, maybe give somebody a false sense of comfort or, have them go out into the community too soon. So as soon as I know, we're trying a couple different tests, as soon as I know which one is the best, we will definitely be offering it. We'll send out a Clara blast. We'll let everybody know. But for right now, I'm going to hold off on that because I just don't know the answer yet.
Thank you. Now, when and if a vaccine is developed and becomes available, is that something that you would suggest your patients taking?
Well, I don't know. Not a big fan of the current vaccine schedule, the way that they're administered, the ingredients in them. That being said, we have to wait and see what happens here. I mean, the flu vaccine is, I think, useless, to be honest with you, because the flu mutates every year. And as scientists, they sit in a lab and they guess which strain it's going to be this year, and they make a vaccine. And probably 1 in 5 years we guess right, and the vaccine has some effectiveness. The other 4 years, I don't think that it works. I've seen way too many people get the flu from the vaccine. Immediately after getting the vaccine, they get the flu. I think it creates a lot of problems for people with autoimmune disease, and that it taxes the immune system, and it can escalate their autoimmune conditions. Things like formaldehyde and mercury and things that are in the vaccines are obviously very detrimental to people's immune systems. So I'm hard pressed to think that it's going to be an answer for me.
Thank you. Now, they are showing in South Korea that some patients who were previously infected are not getting sick again, but they're retaining some of those dead cells. Would you consider that an antibody?
I didn't see that information come out. Like I said, this is a virus like I've never seen before. I have one patient, she's been testing positive with the nasal swab for 45 days. I mean, she's still contagious after 45 days. That's very disturbing, and was asymptomatic. I had a patient who was asymptomatic for 10 days and got retested and was still contagious. Again, it's different in every person. There is no textbook we can follow with this. I don't know what to say about that. I don't know, there's questions, are the cadavers contagious after death? Is it still, is it hiding in the testicles? Is it hiding in the eyes? There's so much information that hasn't been validated that I don't know the answer to that. And I think antibodies is what you want to have. When you have antibodies, it shows protection. It shows that your body has seen the virus, learned something about the virus, and is somewhat more prepared than it was before. Whether this is going to mutate like the flu is yet to be seen. My intuition is that this is a one and done, but it's nothing based in science. It's just my intuition that I think once you get antibodies, you should be somewhat protected. I hope my intuition is right.
Thank you. And just another quick question. People are concerned about, I know that we do have families here, all of us, and we're concerned about our family members. What about the children? I know we hear a lot of talk about underlying conditions. What about those underlying conditions that, don't affect a whole lot of people, but are still considered big conditions, like say pandas? If you have a child with pandas and they were to say catch COVID, how would that affect them?
That's a good question. I don't know why. Like I said, this is not a typical virus, but it does seem that children and pregnant women seem to be somewhat protected. They started screening all pregnant women before their deliveries so that they could decide what protection was required, whether they were going to, most of the hospitals weren't letting the husbands come to the births, but they wanted to be able to protect the staff in the pregnant positive patients. And they found very high incidence of positive pregnant women that were completely asymptomatic. It seems to be true with children. I've had a lot of families, the parents get it, and then the kids get a super mild symptom, maybe a headache or a slight fever or a sore throat, something that most parents would have completely written off and not even paid attention to if it wasn't the age of COVID. Children seem to be getting very benign symptoms. I haven't heard of a lot of death in children, nor in pregnant women. I can't say that, with absolute certainty that there hasn't been any, but it's very minimal. And I can't explain that with the laws of nature. I can't explain why that's happening. If a child has an autoimmune condition, would they be somewhat more susceptible? Possibly, but I honestly don't know.
Thank you, Dr. Blanche. That does bring us to the end of our questions for today. I do want to remind everybody, though, at the bottom of the chat, I've put a lot of information in the chat for you today, those smoothie recipes you asked for, stress relief handout, a way to get on full scripts, how do you order your Thieves. I put all that in the chat for today. So if you scroll at the very bottom, there's those little 3 dots, and you can click on more. You can save this entire chat right to your desktop. So if you have questions on that later, where do I go to get Thieves again? You know exactly where to go. Or if you need that cell phone number to text us if you have any interest in drips or future testing needs, you can go there.
So I want to thank all you guys for coming. It really means a lot to me. I'm so glad that you could all be here. We're going to have 2 more weeks, Mondays at 12. So we hope you join us, invite your friends and family. The more accessible this information is, the more we can get it out to patients, the better, because it's really helping. And I think it's priceless. And I think everybody needs all the help they can get. So thank you again for being here. It really means a lot to me. And I hope you all go get some sunshine today. And maybe we're going to get more vitamin D because the pollution is better.
Yay!
Yay!
We need it.
We definitely need it.